You might have heard that said before. Correlation isn't causation. Or this is an association study, so it cannot attribute causality. These are good reminders that we should be careful with interpreting the results of data analysis, but it can give a false impression that we should not talk about causes unless it's an experimental study. To the contrary, understanding the causes is important for any research project because it informs our interpretation. Understanding the causal framework and being clear about what evidence would support your hypothesis or would be counter to it can help us determine which comparisons will provide useful information, or really, what data we should collect at all. An experiment is the gold standard in research because the causal implications are explicit. We flip a coin to see who gets which treatments, so outside of true random chance, the only difference we see can be attributed to that different treatment condition. Not everything is best investigated by experimental design. An observational approach can help really understand the real-world context in better detail. It just means you need to be intentional about how you think about the data you have. You need to be clear about what your primary hypothesis is and what an alternative explanation for differences could be. Even if we do not randomly assign treatment conditions, who is receiving different treatments and why? Do you have a hypothesis really focused on determining a causal mechanism in a direct sense? Or is this more about understanding how a deeper root cause could induce a correlation in two outcomes? Neither is more important as a research topic. It's more a matter of planning what conclusions you would draw before you have data to distract you. Depending on what you find, if you know what you're looking for, you can seek out the evidence that would support it, as well as the evidence that would be counter to your hypothesis, with the hope of ruling out a competing explanation. This is all very abstract. Let's go to an example to make it a little more concrete. Let's say you're investigating treatments for HIV. Suppose there's two treatments you wanted to compare to see which one improves CD4 counts better. To investigate, you collect data on patients with HIV and track which treatment they received. And then you could look at their CD4 count after treatment, and you figure whichever group of patients has a higher average CD4 count after treatment will probably indicate whichever treatment is better. Seems like a good idea. Only problem is the treatments aren't randomly assigned, so we don't necessarily know why different patients got the treatments they received. And importantly, it might have something to do with their underlying disease condition. Let's say one treatment is more aggressive. It really can help patients out more, but it also has some bad side effects. If that's the case, you might see the aggressive treatment appears worse, even if that's not the case. In other words, patients receiving the aggressive treatment might have a lower CD4 count after treatment on average when compared to patients who are receiving a different treatment. Why? Well, because if the treatment is so unpleasant, providers might only recommend it if a patient is really sick. And if a patient is really sick, their CD4 count might be really low to begin with. So if you compare the two treatments in terms of CD4 count at the end of treatment, you might see that the patients on the more aggressive treatment tend to have a lower CD4 count. Importantly, that's not because the treatment is less effective. It's more that these patients just had a lower CD4 count to begin with. So this is how you might change things. Comparing between the two treatments for all patients really isn't an apples-to-apples comparison, because a patient receiving the aggressive treatment might be in a poorer health state prior to treatment. A better approach might be to look at patients who all had a similarly low CD4 count prior to treatment and make comparisons in terms of the increase in CD4 count after treatment is completed. This is why being really clear about your falsifiable research question and thinking in terms of the causal framework can help you plan out your research. You know what the hypothesis is, so you can identify the reasons you might draw the wrong conclusion by mistake. One size doesn't really fit all in most research, so you just need to think about the specific details of the question you're asking and how that relates to the data you can collect. Thinking in terms of causality can help you go into this with eyes open to ensure that you actually have the data you need to answer your question. The following prompts will help walk you through some things to be thinking about. Always start with the research question and how that fits in with correlation and causation. So that way you can, when you get to the end of it, you really feel like you know what to conclude.